During the 1992 campaign, Democratic candidate Bill Clinton appeared on Face the Nation and tackled a familiar theme. How do you pass a huge and complicated program without raising taxes? Our Face the Nation flashback.
From CBS News, Washington, Face the Nation, with CBS News Chief Washington Correspondent Bob Schieffer.
You're talking about programs that cost billions of dollars. When you talk about a health program, health care, that's going to cost a lot of money. How can you do that without raising taxes?
Well, it is if you lead with the tax increase. We need insurance reforms. We need to take on the hospital bureaucracies by first changing the insurance system and then changing the way the rules are affecting them. There are billions and billions of dollars, enough to cover the uncovered Americans in this country, in insurance reforms and other cost controls. So I think that before we agree to spend one red cent on this, we need to know that we have squeezed every last penny out of a system that we know is the most wasteful in the world. We spend more money on health care and cover fewer people than any major country in the world. And the reason everybody assumes it's going to cost a lot more money to provide universal coverage is that nobody so far has been willing to take on the cost control issues. I will do that.
Clinton tried to tackle health care early, put his wife Hillary in charge of the program, but it soon bogged down in a partisan standoff, and 1 year later, the Democratic leader in the Senate announced the legislation was dead. Surveys showed that after a year of intense debate, lobbying, and millions of dollars in advertising, that people knew less about the program than they had in the beginning.